All right. Hello, everyone. Actually, I'm going to put my glasses on because I can't even see who's here. How is everyone today? I hope everyone's doing well. Just want to welcome everyone on this Saturday morning here to our house. And here is Miss Sophia joining us and saying hello. And we just wanted to talk about kids' health and staying healthy during this time and being at home. So for those of you who don't know me, I'm Dr. Pina LoGiudice. I'm co-owner and director of Inner Source Health in Huntington. And many of you know my husband, Dr. Buongiorno. And hopefully this week you guys have been listening to us on our live webinars throughout the week on different topics that we've had. And hopefully we can also continue those throughout next week on just interesting topics as we're all here doing our civil duty and staying home. So the things that I want to talk about today is first about, as many know, I'm a busy mom of one awesome kid that can be very, whether you have one or 20, I'm sure we're all being pulled in many different directions. And the first thing I want to talk about before getting into details about kids' health is more so just about, you as the mom or the caretaker, mom or dad, just about one thing I always try to do is basically I set the intention for the day in terms of how I would like the tone and the energy of the house, because obviously, we have this beautiful energetic cord with our kids, and it's really what we do in our energies that can and will offset their vibration. So keeping our energies down and relaxed and being centered, even though right now things seem completely overwhelming. And, as I always like to say, all of us always have a tornado going around us, and either we could be whipped around it or we could find that center of that tornado and be a place of peace. So that's how I always like to set my day up, if and whenever possible. I know sometimes that doesn't happen, even to the best of us, but I really do try to make that a center goal every single day. I know for Sophia and I, with what's been trying to keep us busy, right? Sophia's been amazing in terms of one thing that we did do on a weekly basis is try to set up goals for us, right? Of what things that she can do for herself, whether she wants to teach a dog a new trick or try to bake something new or interesting. So any of those things, she tries to set up a weekly goal for herself. And then what we do try to do is, also focus our day around our meals. We always try to figure out, okay, what are we going to eat today? How each of us are going to contribute to that meal, right? Sophia has come actually quite the baker. I tell her she could bake and I'll cook. And we're having a good time doing that. And then obviously we're doing a whole bunch of other activities where it's playing chalk or games or outside activities, going for walks or going on a scooter. So doing all those fun stuff in our day that keeps the day busy and going, and let alone the bits of schoolwork that needs to get done, right? I do want you guys to ask questions as we go along, so feel free to put them in the little chat on the side, and so that we can, I'm happy to ask any questions as we go along regards to kids' health. So the one thing I want to talk about first is obviously with the coronavirus, hopefully you've heard in the media and do know that thankfully with this virus, our beautiful children are not getting sick. I think what they are finding that the younger teens or kids in their 20s that are getting sick are kids that vape and already have a weakness in their lung. But thankfully, if your kid is pretty healthy and strong, that kids are not coming down with anything. So, but of course, as any parent would, you obviously, regardless of we're not sure and how this is going to be, you still want to keep your kids as healthy as possible. And so the things that I am going to talk about today are obviously really important for what we're going through right now, but also with just keeping your kids healthy in general, because, in essence, this is like a type of flu, but, as we live in a petri dish, flus are going to come and go. And I do think even with this, we're going to see as it declines later on in the year, usually close to the fall, we might see a little resurgence. So we do want to always keep ourselves healthy and keep our antioxidants high, especially for our kids. So I think the first thing Sophia always knows is about, what does mommy always say? Keep the sugar down, right, in our diet. As much as we don't like that, right? It's really important to, be mindful and even schedule, even during in the week in the diet, about when treats can happen. So keeping the sugar down overall is super important. And then I always talk about keeping dairy and gluten down. That keeps inflammation down. Having lots of fruits and vegetables, a very much Mediterranean-based diet is super important, just for having clean, easy meals. So diet is first important. And then the next thing, what does mom always say about going to bed?
Like earlier is better.
Earlier is better, right? And so we do try to keep a schedule. But how do you feel about that? Do you feel like you like more having that rhythm, or like if there's nights that you stay up later, do you find that you do feel more tired the next day?
A little bit, yeah. And I feel like it's easier for me to fall asleep when I do it consistently, like go to bed at the same time every night.
Yeah, 100%. Our bodies definitely like rhythm. And so Sophia is a testament that keeping it a consistent schedule, obviously there are, whether there's a party or a wedding or something fun to go to, those are outside circumstances, but having amazing sleep for your child and keeping a consistent schedule is something I always say over and over, how imperative it is for their energetic, emotional, and physical well-being. First of all, a routine kids love. It makes them feel safe and secure. Our bodies normally always rhythm in the day, so it keeps us consistent with that. And besides, sleep is the time our body gets to detoxify. It actually cleans out our body when we sleep. It keeps our immune system nice and strong. And, there's a bazillion more studies that, people say, and I've said this to my patients, whether you want to exercise or sleep, I do think, not that I don't want you to exercise, sleep is a very high priority for me when it comes to health and wellness. So we talked about having a clean diet. We talked about having good quality sleep, right? And then obviously exercise is super important in keeping you healthy and strong. So an exercise can mean a lot of different things. So what have we done in the backyard? Well, for us, what's been easy in terms of what? Go ahead.
Well, we have a dog, as you
Right,
know.
exactly.
And so when we let him outside, he just goes crazy. So we get to chase him and play with him, like play with the ball and stuff. So it's really fun.
But it's hard to keep up with him too, right? So it's really strong cardio just chasing a dog. So if anything else besides getting love from an animal, chasing a dog is super important. Hold on, Dr. Buongiorno needs his phone.
Thank you.
So, okay. So diet, sleep, exercise. So now I have on my kitchen table here a bunch of things about what I always tell families that come into my practice about just what to have in stock in the house. The first thing with kids I always talk about is garlic. Garlic is nature's antibiotic, antiviral. It's really profoundly effective for all of us in many different ways. One of a cool trick that I always like to tell my parents is that a great way to get kids to eat garlic, actually, you want to have them ingest a clove, and this is an old naturopathic medicine technique, is basically you can get a clove of garlic, and what you want to do is cut off the end and, oops, I just dropped it, carefully peel the garlic so you don't nick it, because if you, with your knife, nick any part of the garlic, that allicin is going to come out and it's going to be harder for a kid to ingest. So a great way for if your child is sick and really not feeling well is that you get a clove of garlic and you basically want to cover it in honey. Usually what I like to recommend is a honey that is obviously very drippy and oozy, because there are obviously some honeys that are a little bit harder and more condensed. And if you cover the garlic clove, and try to get a smaller one too, especially on the age and the size of your kid. This one would be probably, so Sophia's 11 years old, so if you see one about this size, I would go a little bit smaller. If you could look within your clove of garlic to get one a little bit smaller so she could swallow it. So what you do is that once you've peeled it and you put it on a tray and you cover it in honey, you can bake it in the oven at really low temperature, around like 200, 225 degrees, and just warm it for about, 15, 20 minutes. And then once you take it out, then your kid, once it's a little cooled, can ingest it and swallow it. I mean, some people say you could just microwave it, but I'm not a fan of microwaving the garlic with the honey. I think it just changes the molecules too much. So I think just putting it in the oven and then having your kids swallow it is a great immune booster and tonic if they have any type of virus or bacteria in the system. So that's one easy at home. Everybody has this quick trick. Other honeys, just speaking on the line of honey, I always like to keep in the house is Manuka Honey. Again, it doesn't matter which brand. I really have no affiliation with anyone. But with regards to the Manuka Honey here, one thing that you want to take a look at is that you see that number over there. So you want to get one that with whatever grocery store that you go to, one that has the highest number possible. So this one we were able to find is 20 plus. Sometimes you can get 45, or some stores have, I think it's like either 15 or 18. Doesn't really matter, but Manuka honey in itself is also antimicrobial. So as all mamas, kids love drinking tea, whether, if your child has a sore throat or a sour tummy, making them a nice, again, any type of tea. I should have brought some ginger out. We've made for you like ginger, lemon, and the Manuka honey in. So again, easy ways to get natural therapies that Mother Nature gave us for your kids to ingest, because it's sweet, it's tasty, and it's very healing. If we don't do a ginger tea, if your tummy if your tummy hurts, we'll do a black tea and make it really astringent, because that'll help firm up the bowels. And again, with the Manuka honey. So really simple stuff to have at home. The other thing that I tell families and mamas to do is always have a homeopathy kit. So with homeopathy, sorry for the loud noise. So this is a company that I found online, and they have a whole set. I forget how many are here, but it seems like, maybe around 25 remedies of the most basic remedies, so that if a patient, if a child gets sick, mom can call me, because usually, obviously, everyone knows that kids get sick after 8 o'clock at night, that these are great remedies to have that are a basic set. This company, again, I have no affiliation. It's 1-800-homeopathy.com. And they have this beautiful kit where you can get all the basic remedies. And usually, and if you have any questions, or if you can't find this, you could just, shoot me an email. And there are just some basic remedies that are amazing, either fever reducers or cough suppressants or anything that heals the body. And besides this one, the one I forgot to grab is the oxacillocossinum. That's an amazing flu remedy. Actually, do you want to go downstairs and grab one from Dad?
Okay, sure.
Okay. Sorry, Sophia's going to leave us for a second. So anyway, so that's a great flu remedy, and they have a kid's version and an adult version. So homeopathy is extremely powerful when it comes to colds and flus and getting our vibration back into balance. So I do always tell families to have a home kit all ready to go. So in case they need me, or if they want to look stuff online. Thanks, sweetie. So this is the oxacillocossinum. Of course, it sounds like a mouthful when you say it. And again, I have no affiliations with anybody of any product that I'm talking to, but I just think these things really work. And so they have a junior version. You take it the same way, but the dosage is a little bit different for kids. And this can go for itsy bitsy kids all the way up to your teens. So usually, like if you have a son who's 16 years old and he's more like has a big body frame, then you can just go to the regular adult one. So I love homeopathy. I love honey. The garlic works really well. I think other things that we do for Sophia in terms of everyday health, right, is just making sure she gets her daily vitamins. So obviously when Sophia was little, she did not know how to swallow pills. Thankfully, mom came up with a trick, right, to teach you how to swallow some vitamins. So at Whole Foods or any other health food store, there's a company that would sell like these little organic candies that look like Tic Tacs. So they were really small in size.
You could also use Tic Tac.
Yes, but we like to keep it clean, right? So with that, I would have Sophia as a little game just try to swallow a candy whole. So that was fun. So she was willing to do that, and it wasn't so scary, right? Yeah. Was there any other type of trick that I told you when you had to learn how to swallow a pill?
Well, yeah. Well, we started with the small ones first because obviously there's different sizes of pills. So like we would also use like an empty capsule, like just the outside part,
right?
Like the smaller one. So you just get used to eating it whole, like drinking it and stuff with the water. So that made it easier. And then eventually you move up to like a bigger one if you need to.
Great. Yeah, and she did really, really well with it. And, when we talk about, eating a piece of chicken or a piece of fish or having a bean is pretty much the same size as a vitamin. So definitely, creating a positive headspace for your kid that's really not any different than eating food is a really easy thing to do. I know one thing that I always have Sophia for basic health is that we always have Sophia on a multivitamin. We always have her take a fish oil, and this is and when she was younger, we had her doing a chewable multivitamin and then a cod liver oil liquid that we had, and then we always had her doing a probiotic, and then this is obviously a capsule one, but we did have her do either when she was really, really little, because unfortunately Sophia was born C-section. And so we had her from when she was newborn doing a powdered probiotic, and then she graduated to a chewable, and then eventually was able to do a capsule. So really taking vitamins in the morning has been pretty easy, right? And so I think also you've been one of the kids who at school who are not out sick too often, right?
Yeah.
No, so you've been doing really well. The other thing that I like to talk about is other things that if Sophia does get sick, I love this one. This is a combination because basically what you need for kids' health. I love elderberry syrup because it is a great antiviral for any type of virus. I know with the whole coronavirus, there was, I don't even know how it even started, but a huge wave around the globe that taking elderberry created more of a cytokine storm, which is not true. So I have spoken to many of the leading experts in my field. We've had, I'm on a naturopathic board discussion group, and it's been discussed ad nauseum, and everyone in different literature definitely could say it's still safe to take elderberry, and it's safe to give your kids elderberry. And when a child is sick, the things that most important to boosting the immune system is obviously you have the different botanicals and the garlic and things to help boost up the body, but taking the different vitamins is also very helpful, whether it's vitamin A, increasing their D, increasing their zinc, all super important to help boost the immune system. The reason why I like this product is that it tastes really good. It tastes like a blueberry syrup. You could put it in water. They could take it right off the spoon, and it's so easy to get down. And elderberry on anything, I think, tastes delicious, right? This is really good,
it's
right?
Sweet.
It's sweet and good, right? Other things that you guys can do is actually, I'm a big fan of creating tinctures, because if your kid has enlarged adenoids or gets regular ear infections or gets regular bronchitis, making your own tincture where they could do a gargle and spit, it's very easy for your kid to do. So what you can do is that you can actually buy on Amazon or anywhere these amber bottles, these amber tincture bottles. And just to show you what it looks like, so you'll see like it's a little dropper full. And so what you can do is, I'm just going to get my other herbs here. So if your child is getting a sore throat, I always like to have a couple of herbs on hand. So one is echinacea. Another one is Oregon grape. Lobelia is a great herb for if they have more bronchitis. So this I'll talk about in a minute. But what you can do is that I will buy the herbs separately, and then very simply, you can either use a funnel, or if you have a good steady hand, you make your own tincture. You basically, let's say, use, you know, again, this is a 4-ounce bottle. You could actually get a 2-ounce bottle is what I usually would recommend. So it's smaller. And you could do your own mixture where you mix half echinacea, half Oregon grape. And so you always have it on hand. You could put your own little label on it. So you know that if your child is not feeling good, you have your own handy little tincture that you can make, again, for sore throats or bronchitis or ear infections, that they can gargle and spit. Because even with sinus infections, the gargling will get up into the adenoids and back into that deeper sinuses, and will help clear them out. So that's a very easy thing that you can do. Obviously, you can go to your local naturopath and say, hey, I need a tincture, if you don't want to buy the bottles yourself. And it's something that we absolutely can do for you. The other thing, before I'm going to get to some questions. Oh, wait, actually I can get to one now. So you can't hear the sound. We can, okay, I'm sorry. Let me see if about, okay, no, I'm not on mute. Do you want to go get Dad to see if he could help out? So we're going to have a technical difficulty apparently. You can't, it is coming through?
Yeah. I don't think it might be that.
Maybe if you don't mind checking to see if you're on mute or put your volume up.
Ask if anyone else
Can anyone else not hear me? If please just type in if you can't hear. Okay. No, it seems like others are hearing fine. So thank you guys for typing in and letting me know that you hear okay. So just making sure you have your speaker turned on. So the question though that she had, so she loves the VitaKids Immune, so she takes that. You recommended, I recommended, that's great. But how many weeks can she take it for now? She's 8 years old in June. Yeah, we are recording this, by the way, so hopefully you can upload it again once we're done with this. So with the VitaKids Immune, basically, personally, could you take it every day? Yes. Do I think you need to take it every day? No. If you have the other vitamins, whether your kid has their multi, their megas, their probiotics, you don't need to take the VitaKids Immune every day. Because for me, as a practitioner, I like to updose this when your child is sick. So if you've been taking it for a while, take a break for a couple of weeks and still be consistent with your other vitamins, your multi-fish oil and whatnot. And then you can go back on this. But this can be taken regularly without any fear or concerns. So hopefully that answered that question. And somehow I got frozen, so hopefully you're able to lock back in. Okay, so thank you guys. So I'm gonna move on and talk about some essential oils. So what I usually do is that in my bathroom, I have a preset container so I have other essential oils that I use in-house, but I keep one of just the remedies that are for colds and flus, so that I'm not having to rummage through all my oils, because I have like a bazillion of them, that I could just easily access it. And then I have, okay, and then someone had another question. I'll get back to them. So, okay. So with the essential oils, like I will have oils like RC blend. And again, you could use Young Living, you could use doTERRA, you could use any type of organic oil blend. You know, I like these because the Young Living already have blends that I think are wonderful. So this is RC, this is great for sinuses and to apply on the chest or even apply down the neck on your child when they're sick. Breathe Again is a great roll-on that, again, you could put on the chest of your child while they sleep at night. Ginger is fantastic for, again, where there are any cold, flu, digestive upset. You could actually apply this couple drops. Again, you always with essential oils want to test it on your child's skin before applying the oil direct, because you don't want them to get irritated and get a burn. If their skin is sensitive, you can put this in a carrier oil like coconut oil or olive oil. And so that will lessen the amount and their skin won't be as sensitive. But ginger, again, you could apply right into their belly button. That's also very healing for colds, flus, and any digestive issues. So, and then of course now with the whole viral issue, I always have a diffuser going on with thieves just to kind of clean the air and clear the microbes in the air as an antimicrobial, so that we're not constantly breathing in junk either. But I think having a set kit that's already done with your essential oils, I think is extremely handy. Obviously, other ones that I have, I should have put this in order, is eucalyptus. I love oregano. These are all upper respiratory lung tonic ones. Thyme, rosemary. Those are all beautiful oils to have in the house, because even I will always recommend, depending on the age of your child, if your child is itsy bitsy and an infant or a toddler, you know, basically closing the bathroom door, plugging up the shower drain with a washcloth and allowing the shower to run so the whole bathroom gets steamed. And then you put a couple essential oils of your choice and allow your child to play in the bathroom and they could just hang out. So that they can breathe in and get into the sinuses, into the lungs, all the beautiful antimicrobial parts of this. Other times with Sophia, I've just put the diffuser in her room or I've applied it to you directly, right? And that's been fine. We've also even done just even for stress management at night. Sophia loves having her feet rubbed, right? And so I'll get some essential oils and actually at the bottom of our feet, in between the first and second toe, there's a divot. And there's an acupuncture point called Kidney 1. And so if your child really lives in their head or just is feeling overwhelmed or they just need to calm down more, that's a great place to put, whether it's like lavender or peace and calming or any other soothing type of essential oil, chamomile, valerian, in that spot, and just rub it in there and it brings their energy down and it's very, very grounding. So that is a great thing to have with a set of essential oils. Going back is, I think the question was, is this homeopathy kit especially for kids? I think on their website, it may say like pregnancy and postpartum, if I remember, or it may say for kids. Either way, there's still the same remedies that you would want to use. They have arnica in here, they have chamomilla and belladonna, they have gelsemium, bryonia, anything this is all great for like acute remedies to use. Obviously, if you're seeing a classical homeopath and they're doing a constitutional remedy, that's very different than this. But, you know, and usually those constitutional remedies can be used for chronic issues. But here, this is really just more of on an acute state. So let me see if there are other questions. I'm just going to go back. Thanks for being patient with me. Okay. Okay. So Okay, great. So I'm glad for the most part people can hear me. So what I want to do now, because we're 30 minutes in, I would like to open it up to more questions, if you have any, about basically what we do here in our home, what I've done for Sophia to keep her so awesome, right? Hopefully you do that naturally. Um, as well as what I recommend to my patients, especially for cold and flu season, but a lot of hydration, a lot of rest. Oh, food wise, making sure soups and stews, making sure their foods are warm and cooked, because I know one of Sophia's favorite is, and you like grandma's chicken soup, much better, because what my mom does is she just puts a ton of garlic, parsley. I've had my mom add shiitake mushrooms in there, obviously with the chicken, carrots, and celery to make chicken soup. But that's a beautiful immune tonic for kids when they're sick. Probably the last other thing that I like to do is a wet sock treatment. I know my associate, Dr. Dawn, who works in our Huntington office, she was just on News 12 talking about how to do wet sock treatments, but that's phenomenal for colds and flus. So if you're really not feeling well, again, you could always email me and I can give you a handout on how to do that. Because basically what you're doing is that you're getting thin cotton socks, you're wetting them, you're wringing it out really well, and then you're putting them in the freezer and you're letting them sit there. And while they're in the freezer, your child or you, again, this could be for adults or kids, are taking a really nice, hot, warm bath. And when you get out of the tub, and hopefully you have someone here to help you with this, you basically want to dry off, bundle up real well, and get into bed. And right before you're getting into bed, what you're going to do is have someone get those cold, wet socks from the freezer. You're going to put them on, and then you're going to put wool socks over them, and you're going to go right to bed. I have to say, in many, many of my patients and for ourselves, you feel like a million times better the next day if you do have a cold or flu. So we do love using wet sock treatment. So let me see this other question. Okay, so the person who asked about the Vita Kids before is that is basically, again, back with the Vita Kids Immune. So you can take this daily, but I do recommend taking a break from it. So it's no harm taking it every day, but I do like to save this for when your child is sick and not feeling well. So with, like, say, someone who's 8 years old and up, or Sophia's age, you do the recommended dose of 1 teaspoon. And if they're actively sick, I will do recommended 3 times a day while they're actively sick. So hopefully that answers that question. So I'm trying to think, Sophia, is there anything else that we usually like to do? I think we pretty much did it all, right? Because I usually, if you're not feeling well, I have you in bed, I have you bundled up, we do our herbal tinctures, we do the teas, the soups, well, if you don't like, we don't have you sitting in the shower anymore, but sometimes we'll do the nasal steam where you'll
like you put a towel over your head, and then there's like a pot with hot water and the essential oils, and then you just like sit over it and breathe it in, and then it like helps you feel much better.
Right, it really opens up the sinuses, so we like doing that as well. The question is here, can a child with a shellfish allergy take the fish oil? So many fish oil, so it depends on how severe their fish allergy is. So what happens is that certain fish oils, so you have the cod liver, which is just made out of codfish. So if your child can eat regular fish but not shellfish, they can, what you would do is test it on their skin and they should be fine. Some omega oils, depending on the company, and again, this is different companies, they will make the omega oils out of like anchovies, sardines. So then you may also, again, it's also a fish, not a shellfish. So they may do okay, but you do want to test it first before you having them ingest it. Because there are some companies that will use, excuse me, give me 1 second. Shellfish. So you obviously don't want to use those brands. Okay. So let's see. Do I have specific tips for being in a small space, someone who lives in the city, Brooklyn, when they need to stay outdoors as possible? Maybe that person can ask me more specifically in terms of activities or food-wise, or yeah, definitely when you're staying in a small space, you know, I think one thing that's super important is that even if you're living in a small space, you know, I think energetically, and sometimes we just all need to be in our own space. So even if you're in different corners of the room that you kind of designate where this is your child's play space and this is your space, because I know, you know, as a parent, there are just some times where you just want to be left alone, and it's totally okay. Still love your family very much, but everyone, I know Sophia likes to be alone and do stuff by herself in her room, and then, you know, myself and my husband, and then we plan times to come together. So that's okay, whether, you know, and it's really just about communication. That way you say, you know what, I just need this right now. I just need to be either read a book by myself, or I need to unwind. Whether moms, I know I love taking an Epsom salt bath with some essential oils. You know, that really helps me just disconnect and reset. And it's just about open communication, because, you know, it's not about, you know, if you just said, I need to be alone, of course, someone's going to be on the defensive, and that's not the message you want to get off. It's just about honoring yourself, and then people understanding that, you know, and they could honor you as well, is that you may need that time alone. And so I'm not sure if that answers that. So another things also too, you know, if you're also worried about just being in a small space and contaminating everyone, obviously I love diffusing the essential oils that clean up the air, and then using as much, you know, trying to disinfect the house as much as possible, so you're not, you know, cross-contaminating each other. And then this is also comes to the time when you guys come together and also be very creative when it comes to activities, right? Whether it's, we're doing lots of arts and crafts and playing games, and you know, again, we'll have that our individual time where I know Sophia, I know we set up a schedule where she'll have a FaceTime play date with a friend or a cousin every day. So she knows for the week who she could look forward hanging out with. So hopefully that answered that question with regards to small space. When it comes to baking, what can we use to color food other than food dyes? Great question. So what we like to do, so what we, I mean, so if you're going to be, if you want simple version, Whole Foods does make a clean food dye, which we have obviously used, right? Sophia was just talking about coloring Easter eggs. And so I'm just like, well, normally what we do is we'll go get the more clean food dyes, but what you can do is, like, we use turmeric, you could use beets, you could use berries, and those colors are magnificent. So there's some great online websites about using pantyhose over eggs, especially. I don't know if you remember that one, where we would try to you get a white egg, and we put a leaf or a flower that had a design, right? And then you tightened it around with like pantyhose that were like a sheer sock that you're not going to use. And then you would let it sit in water with turmeric and vinegar, like you would with your dyeing your Easter eggs, having the white vinegar with the spice, or you could extract or juice beets or berries, and that'll give you some different colors, right?
Yeah, and also the other day we're trying to like do something with raspberries. So we ended up needing to drain the raspberry juice from the raspberries. So we got like a cheesecloth, that's what it is. And the raspberries ended up dyeing the cheesecloth like a really nice red and pinkish color.
Right. So another activity too is that you could, whether you want to order from Amazon a white t-shirt and use the fruit dye, and you could dye it, and you could tie dye your clothes. But again, for food dye, you could again use anything natural, whether it's turmeric, raspberries, beets, and but again, Whole Foods does make a really cool one that is already set. Let's look at some other questions. Let's see on the side here. Okay. Is there a specific brand that you like for a multivitamin? So when it comes, so yes, we do have some brands that obviously we research a lot and that we're very particular about our vitamins. We're making sure that they're the utmost quality, clean, that they're gluten, dairy, soy, no fillers, free. So we're very, very particular about that. So for Sophia's age, who can swallow a pill, we like the Thorne basic nutrients for kids. So this is, and the reason why this is so great is that if you could see, I'm going to try to pick one up for you. The tablet is really, really tiny. It's probably the same size as my pinky nail. So this is super easy for her to swallow. Because again, this is probably maybe just a touch bigger than that Tic Tac that we practice with. So we do like the Thorne as a brand for a pill. We have used, we like in the office, we carry Douglas Labs. They have this ultra preventive kids chewable that comes in grape or orange, and that's a very clean, high quality. It's the same company that makes this VitaKids Immune. It's the Douglas Laboratories. So I love their chewable. I do not like gummies. There's just usually so much garbage in gummies and they're too sweet and a lot of sugar. It kind of defeats the point. So I usually never recommend a gummy. So if your child is small, then there are companies that do make liquid multivitamins. So that I would also recommend. So then how many drops of oil in how much water for diffusing essential oils? So different companies will have different recommendations. Like I know with Young Living and the Thieves, they usually recommend 10 drops to diffuse. Personally, I'm not a great fan of that smell. I know Sophia hates it, the smell of Thieves, but I do think it works really well. So I'll probably cut it in half when I'm using diffusing that essential oil. But if I'm using like lavender or something where they have oil blends that are calming, I'll still use probably anywhere from like that 8 to 10 drops to be concentrated. But if I don't like the smell too much, but I still want it to work, I'll use less amounts of oil. Let's see some of the other questions. Oops, thank you. Okay. So what about the vitamins prescribed by the pediatricians? Great question. And I am going to say I don't like them. Again, I feel they're very poor quality vitamin. They don't use the appropriate form of vitamins that the body likes to take and utilize. Like for calcium, for example, they'll use calcium carbonate in there, which is basically chalk, and it'll do nothing for the body. So the ones prescribed by the pediatrician, I just think the quality is super poor. I think there's just, I just never use them. So I'd rather you invest and get something else because even though it's covered by, I think those are covered by insurance. I just have never bought it from the pediatrician just because I know from the ones that I've seen, they're just terrible. Sure, Josh, I'm happy to answer your question and I'm happy to see you online here. Okay, so yeah, okay, so fluoride, I'm also not a fan of. Fluoride, there's a lot of information that fluoride is a neurotoxin, so it is not something that I'll ever purchase in a toothpaste for myself or Sophia. Really, when it comes to oral hygiene and teeth strength, obviously you want to have good regular basic nutrition, good digestive health, so you're absorbing the nutrition. Obviously good basic hygiene in terms of brushing your teeth regularly. Flossing is super important. We also use a awesome mouthwash that's all botanical. Actually, you want to go grab that? It's underneath in the bathroom. I forgot the company who makes it, but it's basically, you could, again, it's called Tooth and Mouth Rinse. that again, you want the microbiome of your mouth to be healthy and strong. So kids that are more prone to cavities, there also is another company, I think Zymogen makes a probiotic that kids can chew that will, their research has shown that it will diminish the amount of cavities kids get. So that's a great chewable probiotic that your kids can, it kind of rebalances the mouth flora. So this company, it's called Dental Herb Company. We love this. So we use this all the time. So we brush with a clean natural toothpaste with, like, we have toothpaste with baking soda. There are many clean companies out there with regards to toothpaste, but we never buy fluoride. And Sophia, in her million years, has not had a major cavity that she needed to have filled. So that, I think, I just would never recommend fluoride because of the neurotoxin effect. So I don't do that. And then Dental Herb Company, I know, I think this is great. It's very potent. So with this, what you need to do, so you see this cap size, you basically, I fill the cap maybe not even a quarter way full, and then I fill the rest up with water, and I swish and spit with this. So you don't actually even need even more of that. And the great thing about that, I'm just going to get to the ingredient list of it. It has, like, in here, it says beautiful herbal blends. I think it has myrrh and things that actually strengthen the gum line. And so you're minimizing any possibilities of gingivitis or gum bleeding or tooth decay.
Green.
Thank you, darling. Yes, so it has echinacea, myrrh, thyme, cinnamon, eucalyptus, lavender. So really beautiful, clean, and natural. So let's see if we have any more questions. Otherwise, I'll let the rest of you enjoy your Saturday afternoon. Like I said, this has been recorded, so we can.
There's another one.
Oh,
Bunch of fluoride.
okay, thank you.
Yeah.
Sophia's my so this is why I have you here. And so we'll answer this last question, then I'll let you guys go. So, so girls with chronic UTIs, I'm not sure what age group, but that's not really, you don't really see that. So 6, thank you, Samantha. So basically with there, obviously you want to go over, you know, if she's going to the bathroom by herself, you know, how she's wiping. You always want to teach your daughter to wipe from front to back, not back to front, because that could bring the E. coli and the bacteria forward. So that's just basic, how do you do things? So that's super important. 2, obviously, you know, again, what's the flora and what's happening down there? Because obviously it's not like we're a grown woman. There are obviously other more adult reasons as why a woman can get a UTI. But that being said, making sure she's on a good quality probiotic, you could want to make sure that her immune system is nice and strong, that she's not having lots of sugars. Colors and dyes can be very irritating for the urinary tract for girls. You do want to make sure that I always like recommending a cranberry powder or a cranberry juice diluted works nicely. And then also D-mannose is a powder form that kids can also take that can also help try to bring down the frequency of infections. But that is also something that you would also want to follow up with a pediatrician just to make sure there are not some structural issues that maybe sometimes kids do need an ultrasound. So obviously safety is a priority, making sure that is checked. Let's see. So last 2 questions. So are you cleaning with stronger chemicals at this time? Unfortunately, yes. So what I make sure that when I'm cleaning the house, I don't want Sophia around. One of the things when using like bleach or these heavy cleaners, because obviously, you know, when you look at the literature, vinegar is not enough enough to kill this virus of what's going around. So you do need, unfortunately, stronger chemicals. But obviously my concern with concern for myself it's more of a major toxicity for your kids. So I do try to send Sophia, if it's not raining or even if it is, just go outside, and I open up all the windows in the house so that I'm not inhaling it as much as possible. But then I am using stronger cleaners at this time, but I don't want to impact her. So I try to get her out if possible, and not around. Or if, you know, she has her bedroom and you're cleaning the other aspects of the house, and if you're in a smaller apartment, for example, try to clean, maybe not clean the whole house at one time, like focus on the kitchen one day, you're airing out the windows, you do a bathroom another day, and you stagger it so it's not overwhelming for someone who's living in an apartment. So someone else asked, what else is time good for? Dr. Peter mentioned yesterday, because Dr. Peter did a great lecture on mood and anxiety during this time. Time is, for me, besides what Dr. Buongiorno said, I know I have it here somewhere as an essential oil. I also love to cook with it, but it's a great antimicrobial. It's fantastic for opening up the sinuses. So, so besides helping mood, I'll use it as an antimicrobial. I think it works great. Josh, I hope you and the family stay well too. Thank you so much for joining. Vicky as well. All right, guys, I'm going to let you all go. I want to thank you so much for joining me today, and Sophia. And I'd like to thank my beautiful Sophia for being a great partner. So thank you guys so much. I hope to see you soon. And if you have any other questions, feel free to email me or give us a call. And everyone stay well, stay safe, stay sane, and look forward to our next webinar on another interesting topic. Okay. Thanks again, guys.
Bye.
Take care. Bye.